Dear students and guardians, myself, Professor Dr. Anil Vangani, I am teaching in Faculty of Homeopathic Sciences at JVWU Women's University for last more than 1 year, and I'm here to share my experience about the curricular and extracurricular activities which occur, which we organize over here for the development or for the overall development of our students. We know only curricular activities, only teaching in classes is not enough for overall development of the students. And here at Jyoti Vidyapit, my experience is so good on this matter. I have seen that there is organizing of so many extracurricular activities which lead to overall development of the personality of the student. It improves their confidence, it enhances their learning, and it helps to make them understand the things practically. In this relation, I'm going to share my experience related to community development activities, CDA. Every month, we take our students for CDA activities under which there is a program that is immune booster program. What we do, especially we organize camps in university adopted villages as well as other nearby villages, and we go for health checkups. Our medical students, they are engaged in health checkups of the community of which we are going to organize these community development program. And by conducting this practical work, so much confidence is developed in them. I would like to share some pictures during this community development activity in which I was involved. Here I'm going to share my screen. Here you can see we organized a health checkup camp and immune booster program at MSVM Senior Secondary School at Mehla. Here you can see various students which underwent the checkup, and here are our students which were involved in this program. Here you can see at the end of program the common problems were worked out, and we addressed the whole school that what can be done to preserve their health, to prevent development of diseases. Here in this particular school, we found that the water in the area where these school students were belonging to was so heavy that they were developing signs and symptoms of fluorosis. We told them how to prevent from fluorosis. Especially, they have to take precaution like boiling the water before using it for drinking, as well as we organize the health checkup We distributed certificates to various students about their health status and suggested homeopathic medicines which have no side effects. Now we go to next picture. Here you can see at Kapadiyawas, we organized an immunity booster camp. How happy are our students, how their confidence is lurking and boosted, and how happy the villagers are that we are there to take care of them. In the background, you can see our college bus by which we reach to the nearby villages within 5 to 10 kilometers of radius from our college. In this picture, you can see we are taking care of the pediatric case also. The students are very curious to know how we are going to take history in pediatric case. Here we are telling them that we are based on objective signs and symptoms. Here's another teacher with me. Here's myself, Dr. Vangani, and here's another teacher, Dr. Anita Verma, with me, who's working in Department of Surgery in Faculty of Homeopathic Science. So we are teaching students, we are training them how to know the complaints of a pediatric case. In this picture, you can see we are registering the health status of persons of, of a boy in a village. We have recorded the, the height, the weight, to know if there is any status of malnutrition in them and to suggest appropriate diet to them. In between, when the students are free, they just took some photographs and see how happy they are with this work. There's no pressure on them. They are doing it with free mind. So at a village, students are so happy in the village environment. Like you can see the farms behind, a tractor is there, and students are enjoying their work over there. Here we are taking care of a geriatric case, an old person. Students, they want to know how we assess such cases, what can be the complaints of old persons, and because of low vitality in this age, how we are going to tackle these cases. We train them accordingly. In this picture, you can see we have organized a camp in a school, a primary school, where we are taking height and weight of the students, and after that we distribute them certificates about their health status and suggest appropriate medicine for them if they are having any illness or complaint. Now here's the picture of another immune booster camp which we have organized in a court campus at Dudu. You can see our team is conducting various tests to know the health status of various advocates and the clients present in the court campus. Another picture of that camp at court campus. So many patients were benefited. Here we like to tell you that for immune booster program, we develop our medicines ourselves in our pharmacy lab with purity, with all precautions so that there can be no adulteration in the medicine. At the end of these immune booster camps, when students request to stop the bus at some natural scenic locations, we help them to take some beautiful pics so that they become happy and their confidence is boosted. Here's another camp at natural scene or a location nearby pond in a village. How happy our students are. Everyone will like to be a part of such a university which has program of holistic learning for our students. So I would like to conclude that this community development activity leads not only in boosting or learning of our students, but also benefits community in various aspects, especially health. We also tell them how to prevent from various diseases. We distribute them immunity booster doses of homeopathy so that they can be prevented from ravaging diseases and remain happy and healthy. So that's all. Thank you.